Welcome back and thank you for staying with us. Well, this is not very good news, but there is a new strain of a viral disease called the coronavirus, and it emerged in China a few weeks ago. More than 570 people have been infected across China. But the World Health Organization said that it will not declare a public health emergency of international concern. Other countries, including Nigeria, are already putting measures in place to prevent the spread of this virus into their countries. How prepared are we in Nigeria? Recall that we have a huge Chinese community, and we have a huge community as well of Nigerian businessmen who shuttle between here and China. So we just might be at risk. But who am I to say anything about this? We have a knowledgeable person in the studio in the person of Dr. Ugochukwu Eze, and he's a public health consultant, Department of Community Health, Lagos University Teaching Hospital. Good morning.
Good morning.
Good to have you with us today.
Thank you so much.
Now, let me just hit the nail on the head. Bim. Are we at risk of having the coronavirus?
Definitely we are. I think you have mentioned it. We have a huge Chinese community in Nigeria. And you can also know that we have a lot of our people traveling to China to import goods into Nigeria. So we are heavily at risk.
Our brothers and
Yes.
sisters.
Yes.
So when you say we're heavily at risk, the measures already in place. I mean, we've heard the Ministry of Health talk about it. We've heard the CDC talk about, Nigeria CDC talk about, Center for Disease Control talk about the fact that, okay, see measures being put in place. There'll be more screening at the airport. Are those measures adequate? Somebody has even suggested we should treat this matter the way the Ebola situation was treated.
All right. So, of course, there are measures that have been put in place. Most importantly, there is a synergy between the port health services at our international airports and the Nigerian Center for Disease Control, and then also some state governments, like the Lagos state government. So there is this synergy between them. Everybody is working together to ensure that Nigeria is protected. And as we can see, the Federal Ministry of Health, through the Nigerian Port Health Services, released public health advisory. Also, the Nigerian Center for Disease Control also released public health advisory. And then also Lagos State Government also released public health advisory, trying to tell people about the virus and what has been put in place to ensure that people are protected in Nigeria.
Okay. Tell us again, what exactly is this coronavirus?
What are the symptoms?
All right, so like we know, it's a new virus that was just discovered.
New virus.
Yes, that was just discovered this year. It started in China late in December, but it was confirmed by 7th of January that it's a new coronavirus that belongs to the family of the virus that can cause common cold. That's mild forms. But in extreme forms, diseases like SARS, the severe acute respiratory syndrome, and the Middle East respiratory syndrome. So this particular new virus belongs to that family.
Let me just butt in here. How is it that this virus that is similar to the one that causes the common cold is now killing people? Common colds don't kill people?
Yes, that's why we talk about the different strains. In a family, you have different people, so that's the way it is.
You have a killer, you have a
killer, you have people who are mild.
You have a priest.
So that's exactly how it is for this family of coronaviruses. We experienced SARS in 2003. That was even the highest form. Killing over 800 people, affecting about 8,000 people around the globe. So this particular new virus belongs to that family.
Okay. So what should we look out for? What are the symptoms?
All right. So they usually affect the respiratory tract, the airway. So the signs are usually respiratory symptoms, as we know, cough, sneezing, fever, shortness of breath. Usually begins with fever. Then after about a week, you have dry cough. And after some time, shortness of breath, and eventually can lead to death if it's not properly managed.
Okay, this sounds not somewhat scary. I mean, cough, sneezing, but just hold your thoughts. We'll still look more on this. We're going to take a moment, but just before we do that, I'd like to let you know that we'll be joined when we come back from the break by a representative, the head response division of the Nigeria Center for Disease Control, joins us from our Abuja studio when we come back from this break. Please stay with us.
Nigeria's premier gateway, the Murtala Mohammed International Airport, is the 9th busiest terminal in Africa, playing host to about 10 million passengers annually. It is through this airport that the nation's index case for the Ebola virus, Patrick Sawyer, gained entry in 2014. To avoid this situation with the new coronavirus infection, which has its origin in China, incoming passengers into Nigeria undergo screening at this point of entry with the aid of the thermal scanner.
Well, I'm impressed. I walked up and everyone was in their mask and armed and ready for action. You can never be too careful.
Quarantining is necessary to ensure that such epidemic is being contained.
The Lagos airport manager, who is here as passengers from an Emirates flight from Dubai, pass through this point, insists vigilance is higher for this set as there are passengers originating from China.
The camera actually would pick temperature, but it has history of people coming in from China. So we are more vigilant too with people on those flights, for travel history.
From this port of entry in Lagos, I hand you over to my colleague Mary Alale Yusuf, who is at the Lagos State University Teaching Hospital in Ikeja. Mary, I hear on good authority that there is no established case of the coronavirus in Nigeria.
Thank you very much, Buki. Let's first establish that there is no case of the new coronavirus in Nigeria as yet. But I'm standing in front of the Lagos State University Teaching Hospital, where cases might be treated if they do come through our borders. We understand that this virus has an incubation period of 3 days to 2 weeks. So someone might very well come through our borders without a temperature, only to come down with symptoms days after coming into the country. I sat down with Dr. Tony Adeyemi right here in this hospital, and she spoke to me about preparedness levels and treatment.
Currently in Lagos, we have the island, the infectious disease hospital at Lagos mainland, which already has designated isolation wards from the Ebola time, which have not been touched, and they are left for outbreaks like this. Other hospitals, because of Lassa fever, which we also have right now, have also instituted isolation wards. Even our major tertiary hospital in Lagos, Lasut, also has isolation wards just in case we have any infectious disease of any nature. So if by any chance we have a suspected coronavirus infection, there are isolation wards on ground where these people can be isolated. Our biosecurity lab is also currently being equipped to ensure that accurate and timely diagnosis is made, and such that it's now confirmed that it's coronavirus infection. Once you isolate the affected individual and continue your supportive therapy, you try to find out other people that this person has been in contact with.
Meanwhile, personal precautionary measures will go a long way to reducing your risk of getting the new coronavirus. Wash your hands with soap and rinse under running water. Cover your nose and mouth if sneezing or coughing, and stay away from people with those symptoms. If you come down with a fever, sneezing and coughing, report to the nearest health facility. Mary Alale Yusuf, Channels Television News.
Thank you for staying with us. We are now being joined from our Abuja studio by the head of Response Division, Nigeria Center for Disease Control, Dr. Olaolu Aderiola. Thank you for joining us, Dr. Aderiola.
Thank you. Good morning.
Now, this matter, again, in the course of the week, someone suggested that Nigerians should respond to this coronavirus matter the same way response was done towards the Ebola virus. How ready is the NCDC, and what's the advice to the people?
At the Nigeria Center for Disease Control, we have structures in place for effective coordination and surveillance. We work with various partners. We have a multi-sectoral technical group that is monitoring the risk and coordinating response. We work in close collaboration with the World Health Organization and other partners. So also with the Port Health Services of the Federal Ministry of Health. So we work together, gather information, and measures are put in place to ensure that if we have any case, we can respond rapidly to this and isolate the patient, have diagnosis, and protect Nigerians.
No case has been reported in Nigeria already.
Pardon?
I said no case has been reported yet.
No case in Nigeria.
But from what you've seen so far, we do know that, Aleo also mentioned it, we have a lot of people coming in and out from the Asian countries into Nigeria, from China and all of Japan into Nigeria, and those who are going there to import one thing or the other. Are these services also extended to the seaports because of the goods that are imported, or is it strictly at the airports only?
So at the Port Health Services, they man all the points of entries, not just the airports, the seaports are also included. And part of the measures, even from China, screening is done to ensure that there is nobody who has the symptoms that comes over to Nigeria. But at Nigeria too, we also screen and take travel history at our points of entry so that if symptoms develop after a person has passed, we can still pick up any person that comes down with a symptom. And based on the advisory we've given, we know that there are people who may pass through the system and later have symptoms. Just like we have in the case of the United States, the person passed through the port, but when the person started developing symptoms, he reported immediately to the healthcare facility and gave all the information needed that he had been to Wuhan City. And based on that, the United States was able to respond quickly. So it's a collective responsibility, not just from government, but also from individuals and the society at large to ensure that we can combat this.
So,
okay. Is it worrisome that in spite of the fact that this virus is deadly, that the WHO has not declared a state of emergency, health emergency, in spite of the fact that Wuhan, where this thing first was seen, has been totally isolated in China?
So at the World Health Organization is a group of technical persons that look at the current information that is available. This is a new virus, and information and investigation is still going on to have enough information to declare a public health emergency of international concern. But the other critical thing to actually look at is there's already international coordination and collaboration to respond to this outbreak. The Wuhan City, the Chinese government, they've taken proactive measures to ensure that this doesn't leave the country. So, and WHO is coordinating with all the ministries of health, providing information, providing technical guidance on what needs to be done. So looking at the response, there's already a response currently ongoing in China and also all the other countries. So in the next few days, when more information is available, the executive committee will meet again to assess the situation based on the new information gathered to determine whether a public health emergency of international concern should be declared. But however, the most important thing to know is that there's already international coordination and collaboration to ensure that this is stopped in the shortest possible time.
Okay, let's just tell us a little bit about the symptoms here, because I mean, Dr. Eze here had mentioned the fact that the symptoms are like the regular common cold signals, but at what point should anyone begin to get concerned?
So people should begin to get concerned in Nigeria if they have been in contact with somebody who had a recent travel outside of the country to China, and especially China or any other country, and that has reported cases. So it's important that this is known. And the other thing is looking at the fatality of this. It is still evolving. It's a new virus. Currently, there are 846 reported cases with 25 deaths, meaning that the fatality is about 3%, which means in 100 people that have the disease, 3 people died, which means that 97 out of 100 are surviving. So it's not as deadly as it's being put across. So from common cold, it could be severe, but once people go to the health facility, immediately then management is being done and the patient is supported and many patients recover. So the message is, if anybody has any symptom, go to the nearest health facility and give the necessary information to the health practitioners so that a diagnosis can be made.
Okay. Now let's come back to the studio. Dr. Eze, what people will be most interested in at this point, therefore, is how to prevent it. So how do we make sure we do not catch this virus if it makes the mistake of coming into Nigeria?
All right, so the most important thing that we suggest, which is contained in all the advisory that have been issued out, is the importance of hand washing with soap and water under running water. You know, so if you are coming in from outside.
How many people have running water?
Okay, it can be improvised. Somebody can pour water on your hand.
Okay.
You know, so that's a way of improvising a running water.
What you're stressing, therefore, is not washing your hand with soap in a bowl.
Not at all.
Aha.
Under a running water, which could be improvised.
Underlined.
Or from a tap.
Okay.
Someone can improvise that. Then also, we also recommend that people who...
At what point, sorry, before you go to
Okay.
that, let's finish this part about washing. At what point do you need to wash your hands?
All right, so anytime you are coming in from outside to your house, you need to wash your hand. Anytime you use the toilet, you are supposed to wash your hand. Anytime you come in contact with anybody that is coughing or sneezing, you need to wash your hand with soap and water.
Take a bath.
But most importantly, if you go outside and you are coming in, please wash your hand with soap and water before you do any other thing.
All right.
Okay.
Next.
2.
All right, so the other thing that is important is for people who are coughing and sneezing, we have what we call the cough etiquette. You know, and we want everybody to imbibe by that. And what do we mean by that? That when you are coughing or sneezing, you don't just sneeze into the open air. You either cover your mouth with a handkerchief or a toilet tissue, or where it's not available, you can cough in, you can sneeze into your elbow, just like the way I am demonstrating it. Mm-hmm. Or also someone has said, if you can't do that, you can just pull over your collar and cover your mouth. The most important thing is that you don't release those droplets into the air. Because when you do that, you are actually increasing the risk for every other person. So for people who are coughing and sneezing, they should obey the cough etiquette. And then the other thing that is important is that when people are having fever and you are coughing, please don't treat yourself. Report to the nearest health facility. And I think it's very important for all health facilities, wherever anybody will present with cough or sneezing or any respiratory symptom, it's very important to find out the travel history of that person. Very, very key. We need to find out, have you traveled to China? Or were you in contact with anybody that traveled with China, just like my colleague from Abuja said. So it's very, very important. So in summary, if I can summarize everything that I have said, Number one is hand washing with soap and water. Then secondly, obeying cough etiquette. And then thirdly, if you're having any respiratory symptom, please report to the nearest health facility. And it's important that every health facility get that travel history from anyone that present to them having respiratory symptoms like coughing, like sneezing, like having fever.
Okay, Dr. Ademola, let me bring this back to you. Sam just sent us a message. He's concerned about the period of incubation, which is 2 weeks. Sam says the measures put in place so far may not match up, considering that it takes 2 weeks for the incubation period. So he's asking the question, how well do we understand the Chinese community or those coming in from China? So would that 2 weeks period be taken into consideration?
So currently, based on the information available, it's 14 days now, but we are still learning more information about this. So it may still be beyond that 14 weeks. The most important thing is anybody that has symptoms of fever, cough, shortness of breath, and has had contact with animals either in China or a sick person should report to the health facility so that a health professional will take necessary information needed. Person will be isolated. Samples are taken to now confirm what is causing that symptom. So the responsibility is with all of us. We should take our health very seriously and important so that whenever we have any symptom, we go to the health facility. Avoid self-medication. That is very important so that we can get to the bottom of what is causing it.
In place of soap and water, can we use hand sanitizers like we did at the time of Ebola?
The best way of hand washing still remains soap, washing with soap under running water. That is the best way. Hand sanitizer comes in when your hand is not visibly dirty and you can't reach out to where there is running water to wash. So hand sanitizers can be used in that instance. But the best and effective way is still hand washing with soap under running water.
Okay. Now, there's this tweet from Festus Akimboiwa who says, I think that the coronavirus is the Chinese version of Ebola. And this is scary. The federal government must ensure proper screening of anyone coming into Nigeria, especially from China. What do you like? I mean, what do you think about that comparison? Chinese version of Ebola.
I don't see it that way, actually.
Yeah, but they've also told us that it's coming from bats mainly.
Yes, from wild animals. You know, we have not been able to establish this particular new virus, where the source. We have not been able to pinpoint this, although there are some reports that say they're from snakes. But one thing we knew was that the outbreak started from a market, a wildlife market in China. The majority of the early cases were all reported to have come from that market. It was animal to human transmission before we now started having human to human transmission. You know, so for now, what we know is that they are wildlife. The disease originated from wildlife and a wild market in China.
Okay, that thing, again, I'll take us back to the people. You know, there's this idea of waiting for when there's a crisis to begin to live healthy, to begin to carry on habits that are actually good for us. How do we change that to that paradigm shift?
I think continuous information, you know, is very important. You know, but I think basically one of the ways to actually, you know, rewire people is through education. Like, I was happy when my son, my 4-year-old son, came in with one of their workbooks. And one of the things that they drew there was the proper way to do hand washing. And he was the one trying to teach me, that you wet your hand, you put a soap, you put your hand under running water. And you see, if that is done from that level, before a child, it becomes a nature. It becomes something that is in him. You don't need to tell him to do that. So as we continue pushing through the social media, through the conventional media, giving information about hand washing, the school is another important point where we can tweak and make it a life, a nature in Nigerians.
You're assuming that the schools have water, right?
That's an assumption anyway.
Okay.
Well, that assumption might save a lot of lives. Dr. Ademola, this is a coronavirus. You say it's a new strain, and so you guys are still studying it. But there are other aspects of the coronavirus going around that people take for granted, so to speak. But while we're dealing with this one, or while we're preparing against this, what would you be saying to Nigerians and those who are watching us from around the world as regards preparations for anything that has to do with the coronary areas?
So the message still remains the preventive things we need to do about personal hygiene, ensuring that we wash our hands under running water. That is very important and key for fighting all forms of diseases. That is very important. For this one is about cough etiquette, which my colleague Dr. Eze talked about. That is very important. It's that we don't cough into the air. You cough into a handkerchief so that you can dispose of it or wash it. Or you cough into your elbow, which he also demonstrated. So coughing into the elbow is very important so that it doesn't spread. The other thing is to avoid self-medication. Self-medication would mask the progression of the disease, and one wouldn't know what the issue is. The other thing, information for the health workers, is to ensure that they adhere to standard precautions, to ensure that they protect themselves and also patients so that it's not transmitted to any other person. Then for the general public, again, especially those who travel, all these measures should be taken. Ensure that you don't stay so close to anybody you observe that is sick or is coughing. So those are the things that really help us. And at the level of government, what we are doing is to ensure that we screen. So the Port Health Services of the Federal Ministry of Health is really much on top of that, and they've been working since the Ebola outbreak in Democratic Republic of Congo. They are taking more measures to look at travel history for people who have gone to China.
All right. Okay, Dr. Ademola, we'll, when we come back from this short break, we'll look at the similarities between the Lassa fever and this coronavirus matter. Please stay with us. Thank you for staying with us. We're still talking health matters. Dr. Eze is here, but Dr. Eze, before I come to you, let me start with the NCDC man. Dr. Ademola, now, there are those who believe that there are similarities. You can confirm. Are there similarities between the Lassa fever and the coronavirus thing?
The similarity between coronavirus and Lassa fever is that they are both transmissible, so it's with close contact with persons. For the corona, the information we have now, it comes with respiratory symptoms, but the Lassa fever, it also starts with initially fever, sore throat, muscle pain, and before it now comes out, we now have bleeding. But for Lassa fever, the vector is known, is identified, is in the rats. And if we keep ourselves from the rats, we know that we can prevent the transmission of Lassa fever. For coronavirus, information available now, we've not been, the world has not been able to pinpoint which of the wild animals has the coronavirus currently, though it's been isolated. Looking at how deadly it is, for Lassa fever, treatment is available for Lassa fever, and when people come with symptoms and it's diagnosed early, people really survive, and we've been improving that in Nigeria. For coronavirus, the treatment is just supportive at the moment, but people do very well with the coronavirus. I said earlier, out of 100 people currently who have coronavirus, 97 of them survive.
Okay, still staying with you, there's a message here from Sam. Sam says it's pertinent that the experts understand that the Chinese are a close-knit people, almost secretive community, which doesn't mix with locals. They even insist on going to Chinese hospitals in Lagos, whether approved or not. The government needs to engage actively with them. How much of engagement is the government having with the Chinese community?
So, the world is working together on this. There's a strong collaboration with China and the Nigerian government. And part of the measures being done in China is to ensure that it's not imported into the country. And we know because of the annual festival being done, we know that most of them will be coming back and they'll be screened. And part of our advisory is for them not to take offense when they come into the country, and more information is asked from them when they come in. So the collaboration is great between Nigeria and China.
Okay.
Okay, Dr. Eze, we are hoping to get more information about this virus because very little is known about it right now. How soon do we expect to get more so that people can begin to talk about other things apart from we don't have the information, we don't have the information? It's a new virus.
Yeah, of course, as we are talking, a lot of research is ongoing, studying the virus itself and then the epidemiology. That's how it is transmitted, how it's spread around the humans. So for now, we cannot say by this time, this is when this information will be made available.
So we should just wait.
Yes, but I know, every day something is going on, trying to know something about the new virus. Mm-hmm. But there is no target. So when we're able to know all the information we are supposed to know about the virus.
But we shall be getting the information as researchers are finding out.
We'll continue to get that information as researchers are finding out things about the virus.
So all we can do right now is just prevent.
Yes.
Prevent.
And then keep ourselves informed about the virus, which is everywhere in the news media.
Keep ourselves with I let us ask a question. We don't have information. So when you say keep ourselves informed,
what I mean is to watch out for the latest information about the virus,
so that we know as soon as new information comes out, as soon as the research results come out, we are abreast. Well, this is not very good news, but the doctors have advised us what to do. Wash our hands constantly. Sneeze into our sleeves and
into our elbow,
into
the handkerchief.
Yes, and hand sanitizers. Oh, by the way, the washing of the hand is not in a bowl if we can help it, under running water.
I actually wish you could get a bowl
poured.
Get a bowl here to demonstrate because
how that can be poured.
Yeah, because the truth is that a lot of people still miss that washing of water. I mean, washing of that, even the washing of hands.
Water.
So my son comes back. He's 5. So he comes back and says, "Daddy, so you wash your hands this way." Mm-hmm. Then you do this, and you do that, then you do that, you do that. Then he'll do this, he'll do that. Is that all part of it?
Yeah, that's
then
how.
You do that, you do that, all of that. Then you now come under the water.
And then rinse your hand.
And then rinse. Once or twice?
Twice.
Twice.
Just to be sure that... but once it's under running water, once your hand is clean, it's clean. You remove your hand.
Okay. So, and that happens as often as possible?
As often as possible. And then especially when you are coming in from outside into your house. Or for other things, when you use the toilet, when you dispose of waste, and when you touch unclean surfaces, or before you prepare food.
So what do you say to parents? Because sometimes some parents have a problem. As they open the door, their children are rushing them. So what do you say to parents at that time?
What you can do, don't touch them with your hand. They can hug you, but they should not
Hug your legs.
No, they just hug the But let them not touch your hand until you have washed your hand with soap and water. That's the information we need to give to parents.
It's interesting.
And some children, I'm sure, are watching too, and they say, Daddy, I can't hug you. You have not washed your hands. You know, some of them are over sabi. Daddy, go and wash your hands, then I will hug you.
Have you washed your hands? But what about the question of water? Now, you guys usually advise people that when you're having a cold, drink a lot of water. Does that also apply here?
Yes, you can. When you're having a cold, those are things that can relieve you of the symptom, especially the nasal congestion. Drink a lot of hot water or warm water, not cold water. So just to relieve the nasal congestion, not to stop the progress of the disease.
Okay.
Well, this is not to cause any panic, but we just have to get ourselves prepared for this virus, which seems to be traveling around rather happily. But we hope that it doesn't make any stopover in Nigeria.
That's our prayer.
So we've been told what to do to prevent it. I will repeat, wash your hands under running water. Under running water is underlined in red 10 times. Wash your hands with soap under running water. If you want to cough or sneeze, sneeze into a handkerchief or into your elbow or into your collar. Just make sure you cover your mouth when you cough or sneeze so as not to spread the virus.
Don't. Some of you do. You turn away to cough.
You're still coughing into the air.
Yeah. That's the air.
That's the air.
And you can notice we didn't mention the hand, the bare hand.
So what about those who cough to the back of
the hand?
That's still not advisable.
So it's elbow.
Because we touch our hands with surfaces. So any cough into the hand, you deposit the organism.
Back of the hand?
Here.
Even at the back of, sometimes people shake you.
Oh, fist bump. Okay.
Yeah. So by that way, you deposit the virus on the person.
Lord, help us. Thank you very much. Dr. Ugochukwu is a public health consultant, Department of Community Health, Lagos University Teaching Hospital, who was with us in our studio in Lagos. And we had the head response division, NCDC, Dr. Olaolu Aderinola, who joined us from our studio in Abuja. Thank you both for coming to alert us of this new virus and tell us how exactly we can keep ourselves healthy and safe.
Thank you so much.
Sunrise will be back with another interesting conversation. Don't go far.